Yeah. So you wouldn't hold this for a second? We better do the second side. It's painless, isn't it?
Yeah.
Yeah. So I used this. Sorry about that.
What's your opinion about lidocaine mixed with the fillers? Do you like filler with lidocaine or without lidocaine?
That's a very good question. We do know that the amount of vascular occlusions went up dramatically once lidocaine was added. We do know also that lidocaine works afterwards but not during. So there's no doubt about it that lidocaine is widening the blood vessels and possibly increasing the risk of vascular occlusion. I haven't passed comment for one reason, that the company said they would change it to one that was less vascular, but they never did, you know. I went in with this, didn't I? So again, thank you.
So you are in favor or not?
I'm
in favor of lidocaine pre-filled?
Let's put it this way. I've done maybe 10,000 fillers, and the people who have problems, maybe they're just unlucky. I use lidocaine.
You use it?
Yeah, but I also often get up beside the patient like this in the middle of the bed. So again, measure it out. So it's going to be one full length. Make sure your needle is primed. Then I sort of go back in. Patient can feel nothing. Make sure you're in the right area. I can see where I am. So put a little bit there. Put a little bit there. Somebody's blocking my light. A little bit there. And who's that blocking my light? Thank you. So that may need just a little more. Make sure every injection is exactly in the right area, because if you put it in the wrong area, it's very hard to change it. So I can see she just needs another little bit here, and then she's fixed. And I also know I just gave 0.1. So when you come out, these little holes close down very quickly, so you have to open them up again.
You need the gauze?
Nah, I can do it here. It's easy enough to do. Good, good. Good, good. So I just need to put a little dot here. So beforehand, I measure it.
Okay.
It's just less than half a needle up. So you see, I can see where my needle is when I do that. That's my exact spot. And here, you can use a bit here as well. So now I'm up to 0.15, and that's the other side done. So it's a very straightforward technique, and
what's your opinion about using needle in this area?
no, it's okay.
It's okay?
You know, okay, so if you're using a needle, sometimes what you have to do is go in here and go all the way back up in here. You see,
Okay.
See why I'm there?
Yes.
Okay, so I can go in there and finish off.
यार ये कैमरा इधर लाना भाई खड़ा रहता है
Yeah. Yeah.
Dr. Treacy,
और ला नहीं नहीं और क्लोज अप कर क्लोज अप
And if you are going into that area, which makes it even nicer,
है ना
then you could You could use a needle here also. That's very safe.
Can you demonstrate with the needle?
No problem. I'll do the other
Yes.
side because I've done that side.
Yeah, yeah.
Yeah.
Is there anyone who is interested in Elance? Please, as a model, please contact Dr. Asher.
Dr. Treacy, for the newcomers, for the younger lot, probably they would want to know when you are going in, you are underneath the muscle, right? You are not above the muscle, because the question that probably Harun was asking you was because if you are above the muscle, probably you'll end up making it more visible.
Okay, do you remember the video we seen?
Yeah.
Okay, so the muscle and the SUF are different at the lateral and the medial aspect. Okay, so when you're going in between area 5 and 6, below the muscle, in the SUF area, and then when you go into the medial canthal area, the SUF begins to disappear, so then you're going above the muscle into that area. So that's why sometimes in that area you get product migration.
Because the fibers of the muscle almost dissipate over there anyway.
Exactly. Yeah, exactly. Yeah.
And the second, probably for the more experienced ones, was that on the lateral side, sometimes when this line is going laterally, which is malar fold rather than the nasojugal fold, some people do, and I also sometimes have to do the individual puncture technique, because you may have to be, because otherwise either it will go above or below the crease, not inside the crease.
You have to be very careful with that area.
Yep.
The first thing is you have to evaluate whether the patient has a malar festoon.
Yep.
Does everybody know what a malar festoon is? Okay, so you've got an eye bag, and then you've got a prominence here. That is not fat, that's water. And if you miss that, and you put filler in that area, it'll look worse.
Yep.
So what you have to do is go underneath the malar festoon, down to the skull in the subperiosteal area, in the supraperiosteal area, and put in some filler, and it'll flatten the malar festoon, and then you can go. Also, for the malar, the nasojugal groove, be careful that it's not a malar festoon, because the two look the same, and never ever treat it from the outside. Always treat it from the inside, because the filler is 98% water, and it'll just suck the water out of it. The malar festoon will get worse. So that's a really important point. Yeah, one of my patients earlier I thought had a malar festoon, and that's why I took the easier patient, yeah. Okay.